Hi, my name is Joseph Schneier, and I'm the CEO and co-founder of Trusty.care. Um, I am a serial entrepreneur. I've had two exits in the past, and prior to Trusty.care, I was running a company for 5 years that was working with older adults, solving the talent shortage in skilled nursing facilities and in independent living, assisted living. And it was during that time of working with the older adult population that I realized that there was a core challenge that we were facing as a society. And that was the intersection between financial wellness and the older adult population as it related to their healthcare costs. And so we founded Trustee with the mission that no retiree should go through bankruptcy because of out of pocket healthcare costs. Many of these things we all know. Fastest growing demographic in the U.S. is older adults, but I think one of the things that people aren't as aware of is that healthcare costs are their second largest expense in retirement. About 85% of older adults are at risk of financial fragility because of out-of-pocket healthcare costs. 25% of them don't take their medications because of cost. And so the big challenge that we're focused on at Trustee is how do we get people the right information to help them to navigate the system and to reduce that risk of out of pocket healthcare costs? What are the levers that we can pull as a company that can measurably improve healthcare outcomes and access to care by improving the cost and benefits utilization? So the second thing that was a core insight as we were building out this company was realizing that surrounding older adults are millions of professionals that are uniquely positioned to be able to provide this type of information to older adults. And yet these professionals lack the tools that connect the dots for them around healthcare costs and navigating retirement. And those are hundreds of thousands of health insurance brokers. You have the insurance carriers themselves, advisors and financial institutions, credit unions, all with touch points with older adults, and yet none of them have really clear tools that help them to not to tie together the pieces of both cost and healthcare navigation. And so that's what Trusty has built out. We are an AI-driven system that empowers professionals to provide hyper-personalized direction for older adults. And this isn't care navigation. This is connecting the dots between your healthcare costs and reducing those risks. So what we do is we assess an individual based on their healthcare needs, where they live, their income, uh, which pharmacies they're going to, about what their risk is of incurring out-of-pocket healthcare costs. Then we recommend the right suite of health insurance products that help them to cover those costs. The first step that we see is make sure that people get the right coverage in place that actually addresses their particular healthcare needs. And then we analyze that individual to see, are they eligible for additional benefits? And if there are gaps in care and coverage that they can't afford, how do we help them to address those gaps? So the step one in our system is the beneficiary connects up their Medicare account. This allows us to port in all of their claims data. Um, that means that we get to see a ton of information on their utilization, current utilization of benefits and how they've been moving through the system, and to identify areas where they're not using their benefits in a way that is going to best serve their needs. The second step is we identify the right fit insurance for that individual. We push that information to the professional who is managing this process. And then we connect that beneficiary up with the right benefits that will help them to address any other gaps in coverage. So those could be things like, are you eligible for a reduction in your electricity bill? To you should be switching pharmacies because the pharmacy you've been going to is out of network, and so you've been spending twice as much as you need to. We have a really simple model. We sell the platform in a SaaS per seat model to the professionals that are licensing our products. We help them to streamline both their insurance sales and to provide an added value to their customers. And We've gotten tremendous traction. So our product is in market. We are receiving revenue for our product. We've got a partnership with the National Council on Aging. We're featured on Medicare.gov. We're working with 200 million data points. We have 42 enterprise contracts. And by September, we'll be at about 10,000 brokers, reaching about 1 million beneficiaries. We also have a project we're working on with the ARP Foundation and a data research project that we're working on with Munich Reinsurance. We are really different than any of the other products in the market in that our product looks at an individual holistically. So we're looking at all of the different things that an individual needs in order to achieve financial stability related to their healthcare costs, instead of just accessing benefits or just accessing insurance. So if you think about us, like we are automating a professional to be able to be a full service HR system for an older adult, for a retiree. Our team is quite diverse. Many of them come from the insurance industry. Half of them have worked with me on 2 previous businesses, and it's a diverse team that has a real passion for making this change. We're also surrounded by a working board of advisors that also come from the health insurance space that are helping us to understand what guidance in healthcare utilization looks like and how to improve our system to better recommend the right products to individuals at a time in a timely way that helps them to reduce their costs. And that is us. Trusty, we are a growing scalable model. We are selling a product that is desperately needed in the insurance sector, and we're providing a benefit to retirees that helps them in measurable ways to save thousands of dollars a year on their healthcare costs. Our mission, again, is that no retiree should go through bankruptcy because of out-of-pocket healthcare costs. Thank you.